You're going to have a chaplain, you're going to have a music therapist, you're going to have a social worker who's coordinating resources. And you will have an aide that will come generally up to 3 times a week to give baths and do personal care. Some hospices also offer massage therapy or a chore worker, but not always. It very much depends on hospice to hospice. All of these services are not available all of the time. But you are not looking at the hospice providing in-home 24-hour care. Honestly, nobody can afford that. Medicare pays a flat rate per day regardless of what we pay for, and out of that flat rate has to come all of our labor, all of the supplies that we pay for, all of the medications that we pay for, the insurance that the business has to carry, everything. Believe it or not, hospice is a very low profit margin business, and nobody goes into it unless you really care, and nobody stays in it longer than 2 months unless they're slightly insane. So that tells you something. Huh?
How long have you been in it now?
About 5 years. So that's what you're looking at in terms of support. If your person is not dealing with a hospice, if your character's not dealing with a hospice, they're doing all of this on their own. And depending on their own level of expertise, they may have no idea what they're looking at. They know that this person that they love is getting thinner, they're eating less, they're having more restlessness, sometimes their mind is wandering, sometimes they're there, sometimes they're not. They're falling more, they're getting hurt, and then you have to deal with these skin tears and scrapes and cuts on very thin, fragile skin. Even in a relatively young, healthy person coming onto hospice, the less they eat and the further they advance, the weaker their skin gets. The more that they're going to get skin tears, the more that they're going to get cuts. And then you've got to bandage this. Sometimes, if you are very unlucky, they fall and they break a hip or a femur. And if you're dealing with a person in a futuristic or modern society, well, you take them to the hospital. But now you have to decide, do we operate on this? Do we fix this? We're going to take this person who we know is dying. Are we going to put them through the risk and pain of a surgery? And if we do, what's the actual benefit? If we fix this hip or this femur, will they walk again? Will they have any quality of life? Or do we immobilize the hip or the leg or the arm and manage their comfort? I routinely have our hospice doctors write for opioids that would be mind-boggling in any other field of medicine. When somebody comes onto hospice, our company sends out what we call a comfort kit, and it includes a little bottle of morphine about this big, 20 milligrams in 1 milliliter. It is not meant to be swallowed, and it's not meant to go in IV. It's meant to be given sublingually when the person can no longer swallow, because it will drip very slowly down their throat, but it works almost immediately. Why do we have this in people's homes when they may not even need it yet? Because they will. If not for pain, then for breathing. Morphine is a central nervous system depressant. And when you have, during active death, you have people who go into wildly erratic breathing processes. Not because they're in any kind of distress, just because this is part of the normal process of death. So we give the morphine to slow down that breathing, to control the expansion of the lungs so that they're breathing in a more normal pattern. But more normal doesn't mean normal. Sometimes you have pain that just starts up out of nowhere. For 6 months, Dad has been great. He's been walking, talking, eating, and just great. And one morning he wakes up at 3 a.m. screaming. That's why the comfort kit's there. You call the hospice. They have a nurse in our case we have a national call center. In a smaller hospice, they will have a nurse who has this phone directly, and I've done both. They will be picking up the phone, they will be looking up the patient's chart on a computer, and they will be telling you, give this medication, and this is how you give it. I have at 2 a.m. walked a very exhausted person through how to draw up and give morphine sublingually over the phone because it was going to take me an hour to get to their house. I still went, but I did not want the patient to suffer for an hour. This is what your character is dealing with when they're sitting by the bedside. All right? When we get to active death, this person is now actively dying. Now we're looking at a whole new thing. This person who maybe 24 hours ago was fairly mentally active, was walking, talking, maybe nibbling on things. Now they're sleeping. They're sleeping a lot. They're sleeping up to 20 hours a day. They're less mentally active. Now maybe they're seeing things. This is a very normal part of the dying process that we have observed, is people start seeing dead loved ones, people who have gone before. There is a wide variety of explanations for this. If you prefer the spiritual explanation, then those who have gone before are coming back to show them the way. If you prefer the scientific explanation, their brains are being flooded with all kinds of happy endorphins, and they are quite literally incapable of feeling pain. But delusions are a very expected outcome. So they're having delusions. If you ask me, it's a little weird that everybody has the same delusion, so I know which explanation I prefer. But, so they're going to probably start seeing dead loved ones who've gone before. They're going to talk to these people. You're not going to see them, and they may ask you, do you see this person? I'm going to tell you the right answer, and I'm going to tell you the answer that families usually give. The answer families usually give is, no, there's nobody there. The right answer is, I can't see them, but I understand they're real to you. You know? Because the thing is your dying person knows that they are dying. They are aware of this. Regardless of whether you as the family member has decided to not tell them, or has decided that your hospice people or your nurses can't use the word death or hospice, believe me, this person knows. They know whether they are 10 years old and are dying of cancer, or they are 110 years old and are dying of old age. People know. All right? You, as the family member, can allow the medical professionals to talk to them. You can talk to them. And let them decide whether or not they want to talk about this experience with you, or you can decide not to. And there's not necessarily a right or a wrong decision to make here. I know which one I prefer as a hospice nurse, but I don't know that there is a wrong decision to make here in perspectives from families, okay? Sometimes, regardless of whatever else is going on, you as the family member don't have the mental space to talk about this. It's just too much, okay? You're dealing with grief, you're dealing with exhaustion, you haven't slept in 2 months longer than 2 hours at a time. You have your own life going on, you have your job, which you've probably had to take a leave of absence from. You still have bills that are due, you know? Maybe you don't have the mental space to talk to this loved one about their experience with death. Maybe you're not ready to say those words yet. Okay? And that's okay. But keep in mind that this is a decision your characters will have to make. And they're probably not going to make it consciously. It's just going to be I can't accept that this is happening, or I am aware that this is happening and we're going to deal with it. And if they're dealing with a hospice, or they're dealing with, they're in a hospital in a comfort care setting, they will have people to talk to. If they're not, they're doing this on their own, and it is a very difficult thing. So what else are they seeing in active? What else are we seeing in active death beyond a lot of sleep and less mental acuity? People start having very erratic breathing patterns. Depending on exactly what is causing the death, people may or may not do this, but 99% of the time we do. People have these big, deep, wild, rapid breaths. You start seeing the muscles in between the ribs, which by this point, trust me, you're going to see, starting to move on their own. They're no longer breathing from their diaphragm, which is what, adults do, because they lose the ability to. So they start breathing more like 2-year-olds do, with those little muscles in between the ribs. So you see this big chest expansion. Anybody here have kids? Kids? Yeah. So you've seen how 2-year-olds breathe, they're just kind of trying to figure out how to start breathing with their diaphragm, but their chest opens up a whole lot. They look like little aliens trying to breathe. That's what you start seeing when you start seeing active death, because the diaphragm muscles stop working. People kind of die from the feet up. All right. So when the diaphragm muscles stop working efficiently, they start breathing like they did when they were infants. But they're no longer good at breathing like that, so we have this wild chest expansion, wild rapid breathing. I've seen it as high as 60 breaths a minute, which is insane. If you are dealing with somebody who has medication, morphine, or another medication available, you're going to give medicine to slow that down. Not because it's really going to make a difference, but because it will make them more comfortable. Because the thing is when you're having this wild breathing, what you're not doing is getting oxygen very efficiently. Breath is coming in and out, but oxygen really isn't going into the lungs that well. And at the same time that this is happening, the heart is going insane. I have listened to heartbeats at 198 beats a minute. This is generally very quickly very soon before the heartbeat becomes 0 beats a minute. But the heart is going insane, the lungs are going nuts. We're not getting oxygen in efficiently, so we give the central nervous system depressants to slow all of this down to allow these organs to work the way they're supposed to. People will start clamping their mouth closed when you try to put anything in it. Whether it's an oral swab or a bite of food, I have families call me all the time and go, "Mom won't let me feed her." We go out there, take mom's vitals. Well, mom is dying. Mom isn't dying 2 weeks from now. Mom is dying probably within 72 hours of now. And the thing is people know. But the body has some interesting built-in protective mechanisms to keep itself from choking. Part of the normal dying process is, again, people kind of die from the feet up. You'll start seeing a little modeling on the feet. Sometimes it moves all the way up the legs. You start feeling their legs, their feet become cold. It looks like they're developing bruises starting at the feet up. They're not really. It's just blood is moving from the extremities into the internal organs where it is needed most. And once that happens, the internal organs start to die one at a time. We generally start with the bowel. And once your bowels stop working, you no longer have the ability to digest food. So what happens to this food that you're putting into this dying person that they can't digest? Really nothing. It just kind of sits there if they're lucky. If they're not, it ends up in their lungs because they aspirate, they choke, So about the same time that this starts happening, people stop eating They're not hungry. They're not starving to death. They're just not hungry. They're not thirsty. They don't want anything. And if you try to put something in their mouth, they will clamp their teeth closed like a vice. Sometimes you can kind of sweet talk them to open their mouth so you can get a little moist oral swab in there to keep the inside of their mouth moist. Sometimes there's just nothing in the world that is going to convince them to open their mouth. And then we get into the last 12 hours. And I say 12 hours, remember that this is all a rule of thumb, not a hard and fast rule. Death is the most universal process in the world, and it is the most unique process in the world. Everybody has their own story, their own path forward. This is just large overarching patterns. All right? The last 12 hours, you will see the breathing start to slow. Where just a few hours ago it was wild and rapid and they were breathing 24 times a minute. Now it starts to slow. And sometimes they're only breathing like twice a minute. You have these long periods between breaths. The technical term is apnea. And in these last 12 hours, you're sitting there with this dying person that you loved and you still love, but now you're exhausted and you've been watching this go on forever. And you're ready. Ideally, you're ready. You just want them to stop suffering. You just want them to have some peace. But you're sitting there and you're watching, and you have 30, 40 seconds where there's nothing and you think, finally, they're gone. And then they breathe again. And this can go on for hours. It rarely does. It usually doesn't go on for more than an hour, but it can go on for hours. And that last little bit, I swear, is just designed by God to make sure that by the time that last breath does happen, you are ready for it. Because in a way, it is a relief. It's a relief that it's over. And psychologically, that's what you're dealing with after an extended death period with your character, is relief. Now, the other side of that is maybe 2-3 days later after they've had a chance to sleep. Then they're going to be reflecting on the fact that mom died and the only thing I could feel was relief. What is wrong with me? What kind of monster am I? Nothing. Nothing is wrong with you. It's normal. You're relieved that mom is no longer suffering. You're relieved that dad is no longer just trapped in this broken shell and is finally free. You're relieved that you can get back to your own life, that you can start paying all your bills again, which are, I assure you at this point, behind. You can start making funeral arrangements so that you can start actually processing your grief. You're relieved that you can spend time with your kids again. You know? It's all very normal, but guilt after a death, because of that moment of relief, is extremely common. This is why grief counseling is a thing. Your character may or may not have access to it. Your character may or may not need it. It depends very heavily on the culture your character came from. Does your character come from a culture where death is considered just as natural as life? If so, there's probably whole cultural rituals built in around celebrating this moment. If not, if they come from a more American culture where we tend to think of life as going on immemorial, they're probably stunned and in shock and dealing with a lot of guilt because what could I have done wrong? What could I have done to fix this? What did the doctors do wrong? You know? Nothing, probably. But nevertheless, psychologically, that's what you're dealing with in a culture like ours where we don't view death as normal. We don't have the cultural rituals around dealing with them. even our funeral services in most Protestant religions, and honestly in most American churches in general, aren't very healthy for grieving families. We have a funeral services where somebody gets up and says nice things about the dead person, and they were wonderful, they were a pillar of the community, and they're going to be missed. Generally, we all lie. Let's be real here. I mean, sorry, I've been to services where the 35-year-old gang member who's probably killed 15 people has just died of cancer after their 4th time getting out of prison. And the minute they die, they are a saint, and nobody has anything negative to say about them. We lie. We lie to protect ourselves, mostly. This idea of don't speak ill of the dead. But there's no part of these funeral services that are really centered around expressing or resolving the grief. The people attending the funeral don't have a chance to go and wail over the body or scream out their loss and their anger. We don't have a chance later to talk about the reality of what their life was, the good and the bad. And that's a very important part of expressing the grief, of resolving it. And in American culture, in a culture where death is alien and scary, these are not things that we do. But in a culture where death is thought of as natural, as normal, is celebrated, we do. The closest thing you'll see, I think, in America, in terms of an American religion, is a Baptist homegoing. It is sincerely the most healthy expression of death I have seen in any American religion. You get there, everybody says the nice lying words about the dead person. The pastor gives gives their little benediction and all of that. Then you walk past the casket during the viewing. And this is where people are legitimately expected to wail and scream and throw themselves across the casket and onto the floor and make a spectacle. And honestly, I'll be really honest with you, it looked to me like there was a competition going on to see who could be the loudest. And then after that, after everybody's had a chance to walk by and do all of their screaming and all of that, they all go back to their seats in the church, and there is music. There's loud hymns, and people dance, and they sing out loud, and I swear to God, people were passing flasks between one another. And after that, everybody left and went to a reception where there was food and dancing and very loud music, and everybody talked. They talked about who this person really was. You remember that time that, Jimmy said he was going to walk across the street, and then he came back like 2 days later, and nobody knew where the hell he'd gone to? Those kind of weird stories that, we hold on to. And sometimes we don't tell them while the person is alive. A really good example of this that you'll see in European culture that's well known, at least, because these little cultural things are built all throughout Europe, India, Africa, any place where death is normal. But one that we, Americans at least, commonly know of in European culture is the Irish wake. Something that people may not be aware of, at an Irish wake, you literally sit the dead person up at the table, and people are expected to go talk to them. Because if the sunrise comes, and anybody has any unresolved business, they can't move on to the next life. They're trapped here. So by God, if you have unresolved business, you better go work that shit out. There's food at the table that this person is sitting at the head of. There's drinks. There's games. The cultural reason behind the games is you're distracting Cat She from coming and stealing their soul. Alright? But what you have is a very healthy process for dealing with the grief and the loss. not just of the individual, but of the community. And again, these things exist, these little cultural things exist all over the world and in hundreds and thousands of different ways. Sometimes they're they're local to a specific town. Sometimes they're built into a religion. So ask yourself, what kind of culture does your character come from? Do they come from one where death is normal, where death is honored, where death is talked about? Or do they come from one where death is hidden away, where death is not dealt with? Because that's going to depend very much on what they're going to do in those last 12 hours. And it's going to depend, and that's going to make a very big difference in what they do in the days after the death. Are they ridden with anxiety and guilt, or are they planning a party and being surrounded by loved ones who are just celebrating life instead of mourning a death? All right, has anybody got any questions? We'll start with you.
Why is falling so common?
Falling?
It's the most common thing the worry we hear.
Falling is very common because you are looking at, as people are eating less, their bodies are utilizing every resource they have just to stay alive and to maintain life. But this leads to atrophy in the muscles, where when I talked about they're kind of wasting away, you're looking at a person whose thigh might have been this big around starting to become smaller and smaller. They don't have the muscle. And you're also seeing bones become thinner because they're not walking as much, which means we're stripping away calcium from the bone. And the person is just becoming more and more weak in general, so they fall. That, and you're seeing, and depending on the cause of death, if we're looking at cancer, dementia, anything that causes a cognitive change, they may not have the ability in the brain to maintain balance. Be amazed just how much of the brain it takes just to keep on your feet and walking forward. I mean, hell, I'm perfectly healthy and I have difficulty with that. But they may not have their brains may no longer have the ability to maintain balance. But honestly, your reflexes slow down, and this is just normal as you get older. I mean, and as you're dealing with anybody who is really above the age of like 65, 70, there's some wiggle room in that in America because we have a very healthy population in terms of very long lives. But your reflexes slow down. You know, your eyesight's not as good as it once was. You know, you're not as quick with your hands or your feet as you once were. You're not going to be running any marathons. You're not hearing so well. And with all of those physical changes comes the ability to compensate less for sudden changes. So you're walking and you stumble, right? You're young, you're healthy, you just move your feet around and you get your balance back, right? Once your reflexes slow down and you no longer have the ability to compensate like that, you try to compensate and then you just hit the floor. I had a patient that I saw just last week he is 98 years old, and he has not yet accepted that he is 98 years old. So he decided that he was going to leave his walker right where it was, and he was going to get up and he was going to go to the bathroom. He stumbled, he hit one wall, tried to catch himself on it, bounced onto another wall, then bounced onto the first wall again before hitting the floor. Weirdly, the most amazing part of this story is the worst thing he had was a skin tear. And it wasn't even a very big one. I got there and I'm like, man, I love you, but the goal here is not to emulate a pinball. Use your walker. Sometimes people listen to you yelling at them better if you can make them laugh to go with it. Not always. Sometimes they just yell back. But that is why falling is more common.
Okay.
Amanda, could you talk a little bit more about the difference in perspectives with an elderly death versus a child death?
Wow. Nick.
And I'm going to add that to the audience.
Nick deals with child death much more often than I do. I could not deal with pediatric death at all. But pediatric death is pretty much always traumatic. You're dealing with, at least, perhaps universally, but especially in America, we look at children and they have their untapped pools of potential, right? And parents, you're handed this baby and you're holding it in your arms and you're looking at it and you have this whole life planned out for it that they're absolutely not going to do. But nevertheless, in your mind, you have this life planned out, and they're going to grow up and they're going to go to college and they're going to, be a doctor, a writer, or whatever. They're going to go travel the world and do all the things that you never did, okay? So from a pediatric perspective, you're looking at not just the death of the child, which is traumatic enough. You're looking at the death of that potential, that life that you had planned for them, Parents are both biologically and socially encouraged to invest everything in their offspring. First time a mother is handed her child, you have this massive surge of oxytocin to encourage a bond. And this is why you see mothers and they stare into the eyes of their newborn kid that can't see yet. And I'm sure anybody in this room who's given birth, you can still remember 30 years later every small little wrinkle and detail on their tiny little newborn faces that are still kind of covered in afterbirth. But you know every part of them, every little wrinkle on their toes, and you remember that forever. It's built in. So maybe now you're looking at a small child who you have all of this potential and you have all of this, you have your quite literally your evolutionary continuation built into, but you have every biological encouragement to bond to this thing, not just as a mother but as a father too. It's less in a father because you haven't carried this thing around in you for 10 months. But it's there. You have every evolutionary reason to invest in this thing. But you have dreams. You have a plans built into this baby. And that doesn't change now that, between the ages of, newborn and, 25, you still have all of these plans built into this kid. Maybe by 25, you're very much ready for them to get the hell out of your house. But nevertheless, you have planned. You have planned for them. And when a young person dies, it isn't just a person. It is a potential. It is a dream that also dies with them. And that dream is unique to every single person grieving the death. Maybe it is the mother going, I'll never have grandchildren now. Or it's the father going, but he was going to play football with me, Or it's the grandparent going, nobody my age should ever have to bury a child. But it's every person who is dealing with this death is dealing with their own dream that they've now lost. But in an elderly person, you're not looking at that. What you're looking at is a person who has lived. I guess the best example of this is maybe 2 months ago. I attended a death for a couple. Both of them. Husband and wife, both over the age of 100. They died within 30 minutes of one another. But he was a World War II veteran, she was his high school sweetheart, they had 8 damn kids. They had 32 grandchildren, they had great-grandchildren, they had great-great-grandchildren packed into this house all at once. And, you know, you're not looking at the death of a dream. You're looking at a loss of a person that you've built a stake in your life. You know, you've used this person as a foundation, you know. Grandpa taught me how to fix a car. Grandma taught me how to make a loaf of bread. These are the people I called for advice, you know. When I didn't know what to do, I could call them and they knew what to do. They always knew what to do, you know. So you have this foundation that you've built them into. So you're dealing with the loss of that. But at the same time, you can look at it and go, but man, the things they did, the time that they had, you know, there was nothing left unfulfilled, nothing left incomplete, you know. And when you're dealing with a death of an elderly person, you both have the loss of that foundation in your life that now you have to compensate for and kind of like scrabble together different parts of your life to make yourself whole again. You have a hole there. But you also have the relief and honestly kind of a soft romanticized notion of what their life actually was. Because I guarantee you that couple who, you know, was well over 100 years old very much remembered the Great Depression. They very much remembered what it was like to not know where your next meal was coming from. That World War II veteran very much remembered the blood and the pain and the loss and the screaming in the trenches. But from our perspective, look much younger, looking at their lives, we can soften these traumas in our heads. We can romanticize them a little bit. And we already do. Look at how romanticized World War II is in our generation. You know? We don't think of it as the trauma of war. We think of it as the great victories of war. And it's a very normal, natural thing, but we do that with everybody's lives. You know? You know, looking at this elderly person, if you stop and think about it, they have seen some truly awful nonsense. They have lived through some really bad times. Why do we know this? Because everybody does. You know, no matter who you are, no matter how privileged you are, no matter how wonderful your life is, I promise you, you are going to live through some truly awful things. But by the time you're 90, your grandchildren are not really going to think about the truly awful things. They may not even know about them, but even if they do, they're not going to know them from your perspective. It's going to be a soft and romanticized version of it, all right? And that's what you're dealing at with you're looking at the older person an older person's death. You're not just looking at from their perspective, the end of their own story. You're looking at the family going and, oh, that's about this life they lived and the things they've seen and the things they've done without ever really understanding everything that they've actually seen and done, because we only have this image that we have in our heads of them, which is usually much softer than the person actually was.